I'd like to thank our panel for presenting these very different aspects of ways of supporting capacity building within states and at the federal level. We are actually at time for lunch right now, and we have food that's out there in the reception area. And so one of the things that we can do, I know folks might have some questions for the panelists. If folks wanted to get, I believe Morgan had said, folks could get their lunch and bring it back in. If you wanted to do some eating here while asking questions, or we can take a vote of the group if you'd rather spend 5 minutes asking questions and then go eat and ask people privately with the panelists during lunch. Do people have a preference? What? Okay, okay, we have a vote here, yes. So we'll take 5 minutes to do questions, then we'll go ahead and break for lunch, and people can touch base with the speakers individually. Yes. So this happy eats better. So if folks do have questions, if you'd like to come up to the microphone. Well, one thing actually I would like to throw out to the group, Brian made a really interesting point that in the support that you're providing to the provider organizations and the communities that you are helping with particular evidence-based interventions, that you're also providing broader prevention capacity outside of those programs in terms of helping them to understand some of these different aspects of the data collection, of adhering to certain processes. And I would be curious to hear maybe from the other panelists as well, either Lisa or Kim, if you have found something similar within the work that you're doing in your states, that even outside of the particular programs that you're supporting, if you're finding that that work is helping to bolster broader prevention capacity and standards within the provider organizations.
Oh, go ahead.
Yes, for sure. We're spending, we have several studies underway and projects where we're implementing data systems, basically, the ability for providers on the ground to be able to collect data, to use data, to feed it back, to use it for supervision, to make it real and ongoing. And it's as much of an implementation issue as implementing any kind of program, because these agencies we're working with are not data savvy. So we're doing that. We're also spending a lot of time on organizational interventions to create teams, to create structures within these agencies that can sustain any kind of evidence-based practice over time. So much of our effort is focused as much on the data systems and the organizational capacity as it is on any particular program.
So we're very much programmatically driven versus systems driven, but with that said, we brought the Nurse Family Partnership, and obviously they were sold on the concept of evidence-based and came to us and said, okay, what's next? Like, the kids graduated age 2, and we aren't currently accessing any other evidence-based programs to continue the prevention efforts, which is when we did our homework and found Carolyn and adopted the incredible years. So I think that not only in the areas of home visitation generally, and the areas of social emotional wellness generally, have we, all ships raised the, what's the? Rising tide raises all ships. That. But just more generally talking about evidence-based programs more often. But I will tell you, it's what David said, the systems move very slowly, and we have tremendous struggles within the bureaucracy, not necessarily the politicians per se, but within our state agencies, to really value the importance of evidence-based programming. And there are a few folks that very much get that, but not necessarily the ones that are moving things there. So the struggle is focusing on the policymakers who have term limits and want quick turnarounds, and the folks in the agencies that have been there a very long time and have commitments to other programming, as well as the funders. I mean, our philanthropic community is very innovative in many ways and not. And so looking to move all of the folks who collectively, with the intermediaries, the developers, and the agencies, I mean, it's just a huge culture shift that is going to take a very long time. But without a doubt, it spills over into all other aspects of the work.
Thank you. And there's somebody at the microphone.
Yeah. Hi, Nicole Bennett, Office of Adolescent Health. And I'm going to try to phrase this in a comprehensible way, but both Brian and Kimberly mentioned the interactive systems framework, and then there was the strategic prevention framework and the communities that care. And so I'm wondering about how the implementation of those frameworks helped to assist the implementation of the programs, and kind of how that was rolled out. It's kind of related to your question, but.
Well, and I'll just go really quickly. We happened all very organic. These are a bunch of lawyers. So they knew nothing about systems frameworks, and they knew nothing about implementation science. And it's been interesting to be here today because we don't operate so much in a research setting at home, while we are working with folks like NERN to further our practice. A lot of it came very organically, and when research showed evidence of outcomes. And so what I'm sitting here taking notes about is us, even as an intermediate organization who has had tremendous success in scaling and sustaining these programs with a very high quality outcome. What is more of the science behind what we're doing, and where do we align with these different frameworks? Because there is a lot of alignment and similarity, stuff that happened very organically in Colorado and was just good, logical, solid practice, is now very consistent in hindsight with some of the research that's been done and these infrastructures that are being put forth. But we actually didn't follow, and still, with the exception of our work with NERN, are very organically creating it as we go and evaluating it as it happens, and then continuing the practice or discontinuing the practice based on the experience. So it feels very different in many ways than the different frameworks that have been, for better or worse, but we're learning from the researchers all the time.
We didn't start out with a framework either. I mean, when we started the epicenter, the first thing we did was look around the country to find a model that another state level intermediary that we could model ourselves after, and we couldn't find any. So in the first few years, we were just kind of making things up as we went. We knew what the sort of global mission was that communities weren't utilizing the programs that worked, and they weren't making strategic decisions about the adoption of programs, and they were struggling with implementation quality and sustainability. So we knew we had those barriers that we wanted to address. But about 2 years into the epicenter, we started to recognize that we were suffering or we were at risk of falling into the same trap that we often see in community coalitions, which was mission drift, which is we all knew we were very busy. We were doing a lot of things, but we didn't know whether we were just being busy or making progress. So then we went and did a pretty comprehensive lit review, and we had a lot of internal organizational discussions and talked about different frameworks for dissemination and implementation, and we backed into the Wandersman's interactive systems framework. But then, the picture that I showed isn't the interactive systems framework. We actually adapted it. We made an adaptation because we wanted to take the funders and policymakers out of the periphery, because that felt like it was just something. It was even described this morning as something we can't control, and we wanted to explicitly try to control and influence that and work directly with the funders and policymakers. Because there was a slide that I skipped past really quickly, a quote that said something to the effect of a dysfunctional system trumps a good program every time, and sometimes the systems don't know they're dysfunctional. If the policymakers aren't really talking to the practitioners, they're just in a contractual fiscal relationship, giving out grants and monitoring and contract compliance, they don't realize all of the troubles that the broken system is causing on the ground. So we wanted to be the ones responsible for carrying those messages back and forth.
Thank you. And we do have one last person at the microphone, so we'll take this last question, and then we'll go ahead and break for lunch. Yeah.
Hi, I'm Katie Beckman, and I work for the Administration for Children and Families. And my question is really seeking your advice. Working for the federal government, we are very interested in funding tools and curriculum and programs that will eventually be in the public domain. And so my question to you is, for something that you hope to be in the public domain to serve some type of public good, so that these low-income communities won't face a financial barrier and uptake but can still have a quality tool, how do you recommend sustainability or maintenance of that tool being an intermediary organization when part of the goal is to keep a tool or a program in the public domain?
Is your question how to identify where there are non-proprietary programs and then be able to disseminate them? No.
I think my question is, if you have an evidence-based public domain tool or program, how do you recommend scale-up of and maintenance of such a program if you want to maintain it being a non-proprietary tool or instrument? I mean, I'm just asking because, and I know that's not exactly what you're doing, but to apply the lessons that you've learned in that paradigm.
Yeah, that's a great question. I think it's tricky. We have developed a number of programs and tools that are non-proprietary, but we're able to hook it into something. We can hook it into a family organization. We can hook it into the state. We can hook it onto something so that it can be maintained and improved. But that does beg the question that we talked about earlier. When there are these changes, then when do you need to do a study in order to see is it still effective? So I think you're asking a very important question, and but one that we're going to have to dig more into. But I consider, just from an ethical standpoint, part of what we're doing, working in the public sector, is to create tools and programs and be able to make them non-proprietary whenever we can. But that also comes with a responsibility to make sure that they are sustained and improved upon.
Okay, thank you all for wonderful information, and please join me in thanking the panel again. And lunch is just outside.